Good afternoon. As Rob mentioned, my name is Glenn Hutchins, and with great excitement, I get to be here and introduce Jesus. Jesus has a wide variety of experiences, skills and experiences, and has filled many roles. Currently, he is the director of the Office of Diversity, Equity, and Inclusion at the Dale Medical School at the University of Texas at Austin. Additionally, he is a professor of practice of social work at the Stephen Nick School of Social Work at the University of Texas, Austin, and faculty in the Health Interpersonal Education Program, which provides academic training to students from the schools of pharmacy, social work, nursing, and medicine. Jesus has dedicated his entire professional career to promoting economic, social, and environmental justice, and has worked at the intersections of health and justice in numerous ways.
All right, Jesus, we're going to turn it all over to you.
Okay, thank you very much. Good afternoon, everyone. I wish I can turn on my camera, but it seems like some technical difficulties are prevailing here, which is fine. As long as you can hear my voice and you can see the slideshow, I'm happy with that. So, Rob, I will ask if you can tell me if I need to speak loudly, if I need to, just let me know so that you can sense the room and I'm able to adapt accordingly.
Yeah, I think we can hear you just fine. You might, a little bit louder would be great, because we got a great big ballroom full of people.
Okay, I will try to do that. So again, good afternoon, and thank you to Glenn for that introduction. My name is Jesús Ortega, and I'm a social worker here working at the Dale Medical School as the director of the Office of Diversity, Equity, and Inclusion. And I'm very excited to be here this afternoon to talk about a topic that I think is very relevant to all of us doing this work. But I just wanted to acknowledge two important things today, which is the fact that today is World AIDS Day, and also the 10th anniversary of this conference. I remember when this conference actually started back then, and I remember one of the organizers, Lee Miranda, I believe so, who I used to work with, was actually some of the people that was working in this group. So I'm very pleased 10 years later to be part of the conference. And today, as Rob said, we want to talk about implicit bias, but also how this impacts inequities in health, in particular around HIV. So, I'm a professor, so I need our learning objective. And I think that the idea for us this afternoon is really to understand what implicit bias is, how it impacts all our relationships in whatever role do you have in the field of HIV or any world itself, and then how impact also our healthcare system, and learn what strategies we can actually do in order to minimize it. Sometimes people have this idea that when you talk to implicit bias, that we are that is somehow negative, right? And I think that part of what we want to talk about that how implicit bias are very important and a part of our own evolution as human beings. So, but before we enter into this conversation today, I want to establish 4 main agreements for all of us. And the first one is stay engaged. I know that it is late in the afternoon, it's been a long day, but I think in order to have this conversation, I want each one of us to be engaged intellectually as well as emotionally. And we want to try to be present as much as we can so that we can also experience some discomfort in these conversations, but it's okay to accept it, to invite it, and to learn from that. So I think that part of what I'm asking is let's all be present emotionally and intellectually as we engage in this conversation. And as we engage in it, speak your truth. And what I mean by that is similar to I statements, but more than that is pay attention to your internal dialogue, what it is that you're thinking about, what is your thought process, and what is the emotion connected to that. And then finally, accept non-closure. This is an hour and a half of your time, and I'm very appreciative of that. At the same time, this is a very extensive topic, and the implication that it has, particularly in health equity, that we actually have to engage with. So first of all, part of what I want to see as a framework of the conversation is that, particularly in the work of HIV, of any work that we would like to do, is really trying to build inclusion for the sense of that each person, from the patient to the clinician and everyone involved, can actually feel connected, not only to themselves internally, but also to the people that they're working with, that they also feel respected for who they are, for what they bring, and what they contributing to that relationship. And being able to feel that they listen to it and they are engaged and they're participating in the decision-making process, and then that they are actually progressing. So that we can all build on this sense of inclusion that engage everyone in the process of healing and curing something like HIV. So part of what we want to do today is trying to understand two main questions. One is, how does implicit bias interact in our everyday life? And two, how we can address them, right? And the impact that it has on health equity. So in order for us to warm up, and I know that some people we have virtually, and some people are in person. So the people in person are going to use your own self-talk about how do you answer the questions. I want to warm it up with some questions before we start. And again, people who are virtually can put their answer on the chat. People who are in person can just think about the answer, right? And one of the things that is important about today is more about awareness. It's not about right or wrong answer. So let's start with the first question, right? As a woman's body mass increases, her pay decreases. Is actually this true or false? And you can just think about it collectively in your own tables, if you are in tables with each other, or you can actually on the chat answer to the question. Is this true or false? And I'm not seeing the chat in here, but if Rob or Natalie are looking at the chat and see what people are answering the question, will be helpful. So let me reveal the answer for you. It's actually true. In the United States and other Western nations, for every 1% increase in a woman's body mass, there is a 0.5 decrease in pay. And actually this gets to 3.5% if we're talking about women of color. So another question I have is, what percentage of leaders and managers are considered to be extroverts? A, 55 to 70%, B, 70 to 85%, or C, 85 to 100%. You can put on the chat letter A, B, or C. And you can discuss in your table, which one do you think? And the answer is letter C, 85 to 100%. In fact, 96% of US managers display high level of extroversion. What it is interesting though, is that only 50% of the US workforce account for being extrovert. So my last questions, and just getting you warm up, right? And I guess that you're getting the idea here. What percentage of male CEOs of Fortune 500 companies are over 6 feet or 180 centimeters tall? If we have people here who use a different metric. A, 30 to 40%, B, 40 to 50%, of C, 50 to 60%. I'm hearing some people are saying C, and that's exactly right. It's 50 to 60% of male CEO, actually 58 of Fortune 500 companies are over 6 feet tall. What is interesting is that only 14.5 of US males are taller than 6 feet. And if probably you noticed, but all the presidents of the United States are taller than 6 feet. So this is actually, I want to start this because in a way, it tells us sometimes or associations and implications that we have that have to do with implicit bias that sometimes we don't think about it. And this is exactly what implicit bias does, right? Is the more that we see two things together, the faster that we associate them. And I think that part of what new science is looking at about how our cells that are fired together actually stay together. And I think that we have a fantastic talk before me here today in which how it is that we can actually change not only the receptor, but the way that we fire our cells in the moment that we perceive something from the outside. For example, if I told you peanut butter, you probably will say jelly, right? And again, that's an immediate association, very simple, and it depends culturally where you're from. Some people say even honey, which is very healthy. But again, part of these immediate associations that we made in our brain, that sometimes we're not thinking about it. And that's exactly what implicit bias is. It's this process of associating a stereotype or attitudes toward categories of people usually associated with their identity, without conscious awareness. And this is very important. So part of how we interact with our social identities is something that I want to talk a little bit about here today. If you see in that graph, you can see on the orange circle, the primary dimensions of diversity. These are the first one that we interact with, and we perceive them based on that information that we were talking about. And then part of what it is important for each one of us is how those social identities interact within me, right? Within each other and in society at large. What is important to recognize is that we are not just those primary dimensions of identities, we also secondary dimensions. And this is more when we get to learn more about each one of us, either our religion, our working styles, our geographic location, etc. And again, all of these identities of us can get influenced by the organizational culture in which we live, and all of them impact the way in which we see our social and racial identities. Now, one of the things that it is important is that these identities are fundamental elements of our self-concept. And by self-concept, I mean the way we see each other in relationship to others and the way that others perceive us that influence how we see individually. And that combination with different configurations is very powerful in how we understand our own life experiences. Now, this formation of the social identities start really from the beginning. See, our cycle of socialization start right when we were born, right? We start learning about, our families, our members of our parents, their religion, and then we start getting institutionalized and analyze this harrowed process of cycle of socialization, because it really tells us that if we don't engage purposely in a process of building consciousness around the ways in which we come to believe what our identities are, we continue maintaining the status quo and we don't really create the change that we need to create internally within ourselves, but also externally within the systems that we live in. And again, the thing is that our brain can really receive many, many bits of information at any one time, constantly. So I want to ask you a question, and remember, this is not about right or wrong answer. This is about awareness and learning. How many pieces of those 11 million are we able to process in any one time? And for that, I want you to join me here with Slido. You can go to slido.com. If you are in your computer, you can just get the track, take a picture of the character, and you can go to the website. And in slido.com, you can actually test numeral 760,427. How many pieces, and you can answer actually the question, how many pieces of those 11 million are we able to process in any one time? 5 million, 500, 5,000, 50, 5,000. Let's give it a little bit of a second. $5,050,550. Just one more second to give you a chance to answer. And I know that the people who are in person, hopefully you were able to do it on your phone. I want to try to include everyone. Okay, so let me give you, so we do have, based on your answer, that 40% of the people believe that we are able to absorb, and some people are still entering. 38% say 50,000, followed by a tie between 500 and 50 with 25% each. Thank you so much for your answer. And the correct answer is actually 50. 40 to 50 pieces of information get actually absorbed the moment in one time second in our brain. Part of what it is said is our brain is really have tons of information that we have received and is processed outside of our consciousness. And we do have a very small percentage that it helps us to create novice inventions and really conscious part of our brain that has some of that information. So now we want to do a little bit of a fun exercise because I want to ask you to read this paragraph. So we were able to read it, right? And our brain, because it has information that we can associate with, we can pretty much read this short paragraph. This is a little bit more complex than, of course, peanut butter and jelly. But again, it's this process in which what our brain does when, and that's exactly what implicit bias is this automatic response that our brain creates in order to interact with the world outside of us. It's like a shortcut that our brain, based on the way that has evolved, it has created responses when we interact actually with people, with places or situations. And part of what implicit bias is that what we don't think that we think, right? Because once it is unconscious, to, in a way, use this stereotype way of seeing the world so that they can understand and it can work with, right? And also build this kind of belief systems in which sometimes it's part of how do we make decisions that are very important to have in consideration. Another piece of the information that we have collectively engaged with is the history of the US. And I think that part of what we see in this timeline, this is important to recognize that within the context of the US, it has been a history that has established power and structural racism in order to create some of the dynamics of the society that we see today. And if you see in that graph, you have 300 years of slavery, followed by 100 years of Jim Crow, and that includes reconstructions within that. And then we have 55 years in the civil rights movement, trying to build racial equity and trying to create, to continue the fight of creating equality and equity within the racial system that exists, and that it was created with that purpose. One of the things that this has created a power structure that anything that is in proximity to whiteness provides benefits and privilege, and opposite to that, anything that is proximity to Blackness, it creates this anti-Black racism that it has in a way established the dynamics in which we engage, including the health systems. So part of what I want for us today is to really think about where within this spectrum we have engaged in the benefits, the advantages, based on my proximity to whiteness, based on my own identities, or my proximity to Blackness, and how that can actually even define the ways in which we interact. I think that one important concept is about this, the way that we interact with our advantages and privilege, how those isms are enacted, right? And when I call isms, either heterosexism, homophobia, sexism, etc. So the historical power that has provided privilege, in addition to prejudice, right, that have come in a form of discrimination, equal the different isms that we engage with. And I know that this is an oversimplified formula, and I have that Dr. Taylor did in 1986, but it has created a framework for really understanding that is this historical power, the way that it has provided privilege to some groups and not to others, and the prejudice that it can come as a result of stereotypes and historical bias that we can engage with, can impact the ways that we enact those isms. And this is not only one, right? This have, and Dr. Crenshaw really brought this concept of intersectionality, that we don't live in our bodies independently, right? My identities, they don't live just in different bodies. They all live in my own body. And I think that I can experience either sexism, classism, ableism of heterosexism, just departing from this idea that one race is superior than others. And this also, this system that have created these systems of disadvantage to people, it have also categorized people based on their identity or their group membership into different groups, that they can actually be privileged, they can be targeted, and they can be erased. And I want to give you the chance to read the definition of each one of them, but I want to share with you how myself, in my own body, can actually live all of them. For example, as a man in my identities, I'm privileged. To give you an example, when I'm teaching some of my students, particularly women, they constantly texting each other to find out where do they park and if they park close to the more lighted area in the parking lot. And I didn't realize until I asked the questions, why are you all texting? And they say, Professor Ortega, because we do have actually to make sure that when we leave at 9 p.m., and that was before COVID, that we all can go with each other, so but we don't go by myself to the parking lot. That's something that I myself as a man, and I'm not saying that no men have to worry about it, but what I'm saying is that I don't have to think necessarily about that in the same way that women think about that they can be sexually harassed or sexually assaulted. That's as a man, right, in one of my identities. Now, as a targeted gay man, I've been targeted many times with policies, being incarcerated in my own country as a result of being gay, and and having many ways in which I've been bullied or harassed just because of that identity that also lives in my body. And now, as a man who is gay, who is also an immigrant, I have also been trying to be erased with policies that have tried to really discriminate against immigrants or people from other countries in this country. So what I'm saying at this here is for all of us to reflect how these identities live within each one of us and how that provides advantage or disadvantages. So for example, in this case, the dimension of diversity, just to give you an example, when it did, is my physical functioning, right? And in terms of my identity, I'm non-disabled. And this is part of the dominant power dynamics, right? Because I don't have any disability myself. And because of that, I can go anywhere without thinking about any barriers. I don't have to be calling in advance to know if I can access the building or not. And I can actually don't have to negotiate with my employer about the definition of reasonable accommodation. In this case, I'm within the dominant group. But let me give you an example in which this is a personal disadvantage. And in this case, it's actually language, right? Because my first language is no English. And it's actually English, my third language. I learned first Spanish and Portuguese before I learned English, right? And I can be somehow categorized within the dominant group. And part of the impact that they can have for being in the non-dominant group is that I can actually be dismissed by others because of my accent, right? When speaking the dominant language, worry about losing credibility or legitimacy. In fact, there is research around this that shows that people who have foreign accents, they lose credibility among the people in the study that was involved, up to 7% in compared to those who don't have foreign accents, right? Except for one foreign accent that has the same credibility or legitimacy as if you were actually native speaker. And that was British accent, right? And we understand why. But we don't want to talk about colonialism today. But I think that the other part is like not being able to understand contrary instructions when there is no availability in their foreign language. So again, this is the ways in which this can actually happen for us to continue reflecting how my intersect of my different identities provide me with advantages or disadvantages depending on my experience. And then, just to share with you, I have this Facebook, and I don't know how they know that I have an accent, but I get that in my Facebook feed, right, as an advertisement. And this is not new for me. Actually, if you're familiar with Monster.com, they actually advised me back then when I was moving from New York to Texas and changing my career and my resume. They asked me, why you don't take some classes in English so that you can lose your accent, so that you can move in the career ladder? Again, this is the ways in which these bias become common expectation and social generalizations. Part of what I want for all of us to think about is how my different identities will actually be able to interact, either if they are closer to the power or dominant areas, or they are actually what Gloria and Saldua calls the margins of groups, right? And again, it's not that historically the positionality of those groups are less powerful than being on the other, but the system in which we live have created a power structure that put those groups at the margins in comparison to those of the dominant. And just to share you, and I can share this document to all of you later. This was actually, I did an adaptation for the work of Rick Arnold. And they have a more complex flower than this one. But part of what I'm showing here is that all of these identities, I can be either on the dominant side of it, as you can see on those inside the flower, right? Because being non-disabled, being middle class, and being a man. But I can also live on the outside of the margin for some of my identity, being a person of color, now consider myself moving into the elderly stage of my age, or being gay, right? So, and one identity that I think that is important and made me think about today was actually my HIV diagnosis as a way also, because I think it is important to put and how important it is also about an identity that people live with, and it has impacted their life in ways that sometimes we don't measure. I mean, we have measured, but probably sometimes personally have not really get involved with that identity. And within that group, right, I have recognized the fact that I'm not diagnosed with HIV, the privilege that it have given me, and the stigma that I don't have to be dealing with. And remember, I mean, I'm little older now, and I was in the 80s in New York fighting with ACT UP really about HIV medication and the investment on HIV research. So again, part of what I want for all of us to think about here today is that social identities, even though they are the first encounter that we have when we interact with people and can generate biases, they're not themselves bad or deficit or oppressive. In fact, they are the source of self-understanding and pride and sustenance of who we are. Rather are the systemic practices of different isms that create the hierarchies that devalue people based on those social group of membership. So I want for us to think about this question, like, because not all identities have the same way, depending on how you interacting with the world, either individually at the interpersonal level, at the institutional level, or societal level. And I want for us to take a moment to reflect on how often do you have to think about each of your identities and what identities are somehow more prevalent than others, right? And I want to give few minutes. I don't have, we can put the people in the Zoom room in breakout rooms. I believe there is like 19 or 22 people. We can put in people in group of 2. Rob, is this possible? And then the people in the, if you are sitting on tables, just talk a little bit about how does if you feel comfortable, of course. If you don't feel, you can just listen. You don't have to share. But how often do you have to think about your own identity and which one has more weight than others? And I want to give you just 4 minutes for that. 4 to 5 minutes. Think about it and how that actually, and I can see that we're creating the breakout rooms now. And then join your table, just turn to the person next to you and do it in diet, and just have a conversation with the person next to you and think about how often do you have to think on your own identity and which one do you think the most? Just make sure that everyone has an opportunity to share their own experiences. Okay, I'm hearing that we don't have breakout rooms possibilities or capabilities, but you can share your ideas on the chat if you want about how often do you have to think about any of your identities and which one is the one you think most or think less or don't have to think at all, right? Let's give 1 more minute for people to share. Okay. It seems like everyone is engaged in the conversation, which is great. So let's come back.
Jesus, would you like for some of the folks here in the ballroom to share?
That would be wonderful and beautiful. Yes, please. That's exactly what I was going to ask. If anyone is willing to share, I would love to hear it, definitely. I'm so sad that I cannot put my camera.
That's all right. We've got some good insights and awesome people here.
Great, great.
We discussed it here in our table, and personally, I only think of it when I'm filling out a job application or health insurance, or if I'm asked, where are you from? That's when I answer those type of questions.
Well, thank you. Thank you for sharing that. Anybody else?
Hi, we're talking a little bit about when we introduce ourselves and we share pronouns. You know, if you are cisgender, you don't necessarily think through your pronouns, you just put them out. But for some of us, when we are introducing, like, we have to stop and think about identity and what we're going to share or not share.
Mm-hmm.
Anyone else here in the ballroom? You got it.
I'm older. I'm 68 years old, and when I was in college, I was always amazed with the people that were of color, and always had these beautiful traditions and stories, and really thought about all of that. And I grew up white, and I never thought about any of it. And I can remember being brought to tears because I didn't feel as rich as their lives were, because I never had to think about it. I had to think about being a woman, but I never thought about being white. I never did. I had to think about being Catholic sometimes, but nothing about white.
Yeah, our folks over here at Yosemite Church are letting you out.
Oh, yes, hello. So, as a young person, like young Black, trying to get into this very interesting world that people have created for me, I think more so about institutional and interpersonal identities before I think of my cultural, because it just is me, right? Like, it's kind of innately in me. So I don't think about them as much, but I definitely on a daily basis, I think, how should I speak today to institutionally grow or get further? And then interpersonally, how do I make sure that I'm in the right groups, or making sure that people can see me as an individual, as someone who's climbing or becoming better? Because I always feel like that innately makes you more valuable to your social class or your cultural class. So I'm saying all the time, but I'm really thinking specifically institutionally and interpersonally.
Mm-hmm. Thank you. Thank you. Thank you so much. And I think that that's a very important point, a good segue in a sense, because one of the things that it is important about how we actually interact with our own identities is that we just know this primary understanding of our identities, right? In which are the one that people can perceive. But yes, this is organizational, institutional, and cultural, the way that sometimes does actually impose on us who we should be, right? And it tries to establish this constant relationship between all those levels. And I think that what is important for us is always to ask the questions about who I am based on who I see myself, but also seeing the reactions of other people, particularly when I interact with different institutions, right? So thank you for those comments, and thank you for the conversation that you engage with. So now I want to do another short activity with you And I know that in the audience, we have probably people who is work in the field of HIV, who have worked with client or patients in the field of HIV. And I want to just do a little activity. This is, again, not right or wrong answer. And I want you to think about what are your feelings, your judgment, or your reactions. When what I want to do is I want to show you a series of pictures, okay? And this is a client or a patient or a person who is coming to asking for services, and you want to meet one-on-one with this person to do an intake or to do whatever activity you do within your organization, or even, you know, a friends of a friend. So I want to show you the pictures. I want you to check your feelings, your judgment, your reaction. But my question is, if you have to meet with this person on one-on-one in a room with this person, who would you prefer to show up? So I want to show you the pictures, and then you will have the opportunity to answer which one do you prefer to show up in your meeting with you. Okay, you have right there, who would you prefer to show up, number 1, 2, or 3, and now you have, again, Slido to answer the question. You can just take it on your phone at slido.com and put number 760427, or you can just take a picture of it from your own phone. Who would you prefer to show up, number 1, number 2, or number 3? And again, this is anonymous, no judgment here. Let's give just one more minute so that you can, I know that the system is taking a little slow in order to show here.
Can you show the slide before? What are the choices?
The question is if you could go back to the slide previously to.
Sure. Let me go back to the slide. Yes. Oh, I don't know. Let me see. Let me try to go back. There we go. This is 1, 2, and 3. Yes. Okay, so it seems if everybody probably has already voted, that number 3 got 71% of the people that you would like to prefer to show up, followed by number 2 with 24%, and number 1 only has 6. So again, let me just introduce now a little more beyond those primary dimensions of identities, right? Just to learn a little bit more about each one of them. And I want for all of us to be very honest in a way, to think about our reactions and why do we pick one above the other, and what it was that it made me to get to that decision when I'm actually saying which one I prefer to show up. So this is actually number 1, the one that has less people. And this is John Fireman. He's actually the current Lieutenant Governor of Pennsylvania. And he was previous mayor of Braddock. And I don't know if you remember during the elections in November, he became very famous because he was in Pennsylvania and it was the whole thing about elections there. He's actually more known well known and recognized by his work in economic development, and because of the revitalization program that he has actually done in his own community. After graduated, he went back and started doing an amazing economic development initiative in Braddock. Person number 2 is Chris Watts, and I don't know if probably some of you knew. This was in 2018 when he was sentenced for life for inhumane killings of 2 daughters and a pregnant wife. And then person number 3 is actually Dr. Joseph Seaman. He is an obstetrician and gynecologist in Lake Charles, Louisiana. And him, together with Dr. Peter Johnson and Max Maher, they created the Pulse of Perseverance, 3 Black Nurses on their journey to success. And this was actually a book of them being through medical school. Now, I want for us just to take a moment to reflect about this, right? What was the life for you? What did you notice? What was your reaction was? And why did you pick one over the other? And how was our immediate reaction or association that we made? So if anyone want to kind of just answer to the mic or put it on the chat, that would be helpful. And again, remember, this is all about awareness.
Yeah.
So, does anyone would like to share?
Anybody here in the ballroom want to share? I'm coming your way.
Any surprise that you have when I actually reveal a little bit more of the dimension of diversities, of identities?
Well, my table, our table chose number 2, and it's, none of us want to be judgmental or prejudiced, but we grew up in a society and a culture that says tattoos are bad. Oh, that it looks mean, so yeah, like for me, the first guy looked like me, and then the second one, okay, and then the third, it looked like he had a bad attitude. So I didn't choose one of the 3. I chose 2, and but it's how we grew up. But now, I mean, we might be moving in a positive way, but slowly, because we do see doctors, nurses that have tattoos, and it's no longer, I feel like we're no longer afraid of it. Oh, my doctor has a tattoo. It's not bad at all. So it's just how we were taught, how we were raised, how all of us have different cultures and grew up differently, and try not to judge.
Yes, definitely. Thank you. Thank you for sharing that. And it has to do with all of this cumulative information that we've been actually, engaging with, learning from, and trying to maintain as a result of our own development process, right? For each one of us, but also in connection with the different groups and that we actually engage with. Okay, so thank you so much. I hope that you enjoy the activity. And again, the idea here is to generate this constant awareness that sometimes we make these implicit associations based on what whoever was actually speaking, and thank you for speaking out, what we actually grew up with, what was the story that it was told to us about certain groups, and we want to talk a little bit more about that, because this is exactly how dominant culture norms are created right? And the thing that is important for us, and this is what Harold was talking on the cycle of socialization, is the longer that you swim in a culture, the more invisible that it becomes. So we start participating on the status quo that established that that's the cultural norm, right? That's the way that we should engage. And again, part of what this dominant culture does is actually create these schemas in our brain in how we process, categorize, and engage with information from the outside world based on the information that we have. So part of what our brain is constantly categorizing based on our own learning. So if I ask you the question, what do you see in this picture? Again, no right or wrong answer here. People can put it on the chat, people who are virtually. And people who are in person, you can just talk to each other. What do you see in that picture? Very quickly, since we're moving here on time. A lady, Danielle say a cow, who else? What do you see? Some people say a piece of fabric. Okay. I hear some laugh. I guess the imagination is flowing.
Said that it looked like a population map of Florida.
Okay, a population map of Florida. Okay, what about this? What do you see now?
Yeah.
Can you actually see the cow now? Right? So again, this is exactly how our brain, the moment that interact with new information, it can actually make different associations in the way that we see and the way we interact with. And that's why this is important, because it creates what we call our worldview or our background and context, which we are engaging with. For example, if I told you and I show you this chair, I can tell you, and we can all agree that it seems like an office chair, right? This one seems more like a reception waiting area chair. And this one looks like a little bit more sophisticated chair, right? Like a living room chair. Part of what is important here is, in a way, we can generally agree that we know where they belong to, what kind of interaction we can have with them, and how it serves us, and how we can actually engage with them. But what happens when this is actually real people? Right? When they are different, when they actually, what is the world view or context that we have to engage with people who are different than us? And I think that this is important, because dominant cultural role establish this background information that if we don't continue this process of conscientizing ourselves, we continue navigating or swimming in these dominant cultural norms that privilege those who have established those structures that have always benefited those dominant groups. And it has also set a series of expectations and common social generalizations that we have in society. For example, in this research, when shown photographs of men with similar athletic abilities, African-Americans men were always rated to have higher athletic ability than white men. Or this common generalization that actually men are taller than women. In this research, again, even when using some reference point, they still think that men are taller than women. And in this case, they're both 5'5". And again, and similar to the different questions that I asked at the beginning, right? All these ways in which sometimes we not paying attention on the association that we made, but that's how our brain have engaged in these dominant cultural norms. And the thing is that differences can be hard to talk about it, right? Differences can be difficult sometimes. And in fact, can make us uncomfortable to talk about them, because in a way challenges what we have to come to believe about who we are, how others are, and how the world is. And the other part of what we don't sometimes engage in these differences based on our own identities is because we don't want to feel guilt or responsible for the injustice that it has historically been associated with this process of creating structures of power that benefit some dominant groups. And sometimes people say it can seem unnecessary, right? But I think that the pandemic, as well as the social unrest that we experienced last year, again, it's not that it's new, but it put in our face the fact that we need to talk about these inequities and the racism structure that exists in our country. Because I can show you plenty of examples, and I don't have time today, that this difference, when we say that it's unnecessary, they are important. This is actually University of North Georgia pamphlet to outreach for students, so that the students can come to their campus. If you notice the picture, it's very evident who actually is the closest to success, right? And we can all say, wow, nobody can tell them before going to the printing about this, right? But that's a very important point, because sometimes if you don't feel that you actually are part of a team, that you cannot raise your voice about it because there will be consequences or retaliation, probably people don't say. And I'm sure most of you in the room recognize in that picture what it's telling all of us about, right? Or this one, right? Microsoft Office launching their main Microsoft Office 2013, big advertisement campaign. And if you notice who are essential, who are introductory, and who are advanced, it goes again with this stereotype ways that keeps being reinforced, that Asian somehow are overachiever and smarter. The whites are probably in the introductory level, but it's very clear also that Black people somehow are only at the essential level. The other piece that is important here is who is not in the picture, and it's Black women, right? If you see the introductory and advanced level, you can see couples of male and female, but not in the essential level. The other thing that it is important is, where do you belong? If you see introductory and advanced level, you can see computers, desk, kind of library or offices environment. The essential level is at the park, which I would prefer personally, but again, it's also telling us who belongs where. Microsoft Office took this down a week after they put this big advertising campaign because of the backlash. But again, part of this is important for us to continue noticing, because this can actually be very important. And sometimes students tell me, Professor Ortega, do we really need to constantly deconstruct everything that we have in front of us? And I say that for me personally, sometimes, particularly for Black and people of color, this is a matter of life or death. And I think we don't have the luxury not to think about it, right? And I think that somebody mentioned there that institutionally, even if we try to forget about it, they actually make the reminder to us that we cannot forget about it. So, and I want to make the connection of all of this, what I'm talking about, because the ways in which implicit bias have helped to create a structural racism historically has been, and I think that Dr. World presenting this graph very simply, but very complex at the same time, right? That we see on the left hand, this kind of ways in which we create primary associations and assumptions about groups in reference to others who are dominant and who are the ones who are believing that they should control. And that has created historically policies and practices like redlining, voting rights, as we actually see in today still. And these practices have created inequitable outcomes and racial disparities that impact particularly those groups who historically have been exposed to the evidence of whiteness and white supremacy. And it provides whiteness as the normalcy or the dominant culture that justifies the inequity. And I think that this is very important in a sense that when it comes to health inequity, right? Defined by Margaret Whitehead, is this difference in health in which are not only unnecessary, but also avoidable. And in addition, they are considered unfair and unjust. So if we think about this raising this identification with group membership that have created this impact, right? It has really to do with the impact that it has on the social determinants of health. And probably most of you are very familiar with this, but I think that I want to call the attention here is that if you see 20% of people's life is really healthcare. The access, right? In the environment that people interact in the healthcare system. 80% of people's life has to do, and people's health has to do with the socioeconomic factors, right? Education, job, family, income, community safety, the physical environment that they live, and 30%, yes, are health behaviors that can impact people's health. But this is very important for us because as we see, particularly within HIV and AIDS, right, we still can see that compared to other groups, Black and African American, gay and bisexual men, it still has the highest number of HIV diagnoses. And one of the things that I want to go back here is that in particular, the socioeconomic factors, 50% of that can actually be traced to where people actually live, the zip code on where they live. And that's a problem, right? So again, we can continue seeing where are the highest rates of HIV, and it is among the Black community. And also one of the things which pertain to this conference here today is also that particularly 1 in 6 new HIV diagnoses continue to be among age of 50 and older. And even though that's represent close to 40% of the diagnosis of people living with HIV, part of what I want to call our attention is that actually older African Americans in the United States face disproportionate rates of acquiring HIV and suffer from higher rates of HIV morbidity and mortality than older adults of any other racial group, right? And again, they accounted for 42% of new HIV diagnoses among older adults. And finally, I think that the older African American people living with HIV have higher odds of vital organ failure and mortality risk that is 9 times of the older white people living with HIV. So I think it is very important for us thinking on the impact that these health inequities continue having in groups. And particularly in the field of HIV, we always knew that the bar before the bars can actually have a bigger impact in how do we create the treatment cascade so that people can eventually become virally suppressed. And it's not only the stigma associated with the HIV, but also homelessness, racism, homophobia, misogyny, shame. And it's at this bar that we all need to engage to how we want to continue working to create a more equitable access to health in HIV and any other area, particularly for Black and people of color. And I'd like to quote Copeland, who is the president of Seattle Black Institute, right? Because I think that when we talk about HIV in the Black community, we must talk about the circumstances that surround it, the contextual aspect of the interaction of racism. And we have to talk not only about racism, but also mass incarceration, homophobia, and also how we bring them down. We must have this structure to understand this structure because they fuel HIV for Black people. And I want to share, and I think that one of the things is that I didn't put, but let me share this video with you because this is how implicit bias affects the healthcare system as a whole. So let me, because I didn't put my sound, let me share again and put my sound here. Sorry about that. Let me share again. Are you seeing it? Yes. Where'd you get? Are you seeing it?
Yes.
Yes? Okay. Can you hear it? Perfect.
So in healthcare, bias comes in various forms. And I would say there's three primary ways that we could actually track bias. One, of course, is in interpersonal interactions, let's say between a patient and a provider. So the unconscious ways that we may have associate certain groups, certain gender identity, people with certain gender identities, people from certain racial or ethnic backgrounds, manifests in the diagnoses we're making, the interactions we're making with the patients, as well as the warmth with which we're working with them, which impacts the amount of trust that they have in the providers themselves. How does that manifest? One of the major ways that's been studied and shown and reported over and over again is pain management. So patients with darker skin, African Americans, receive lower dosages of pain medication across the board, from infants to the elderly, for the same types of ailments they come to practitioners for, because of assumptions that are being made around addiction or their ability to actually be truthful around what they're experiencing. The second way bias really plays into all of this, particularly unconscious bias, is the internal dynamics of organizations, how employees and staff members communicate with one another, team collaboration, team dynamics, but as well as performance reviews, reviews around compensation, who gets to be promoted, who gets to be a leader of an organization, of a team, based on assumptions that we may have about those people, purely based on phenotype, their origins, whatever that may be. And the third way bias really plays out in healthcare, and this is quite well documented across the board, is its costs, wasted costs. So
I'm in a presentation
racial bias,
right now.
just one particular identity that we're concentrating on, costs the US economy, the healthcare system, $310 billion a year. And for me, I just want to think about what can we do with that money if we didn't have bias in the world?
And that's a very interesting question for all of us, right? And a way that implicit bias have a lot of impact in people's health. And I think that we need to, again, and this is something that is individual as well as collective in how we can do this work. And that's what I want to talk about, how we can then, what we can do in order to minimize biases, given that bias is these ways in which unconsciously we have hidden belief, ideas, and values in the moment that we interact with people, places, and situations that have a response from us. Now, one of the many ways that we can become more aware of implicit bias is what I call the implicit association test. We won't have time to do this activity today here because it will take 10 minutes to do the whole test, but I would definitely recommend, if you haven't done it yet, go to projectimplicit.org, right? And this is actually part of you can do it on your phone, and you can pick any of those identities categories that you see there, and you can do the test. You can do it actually on your phone. And part of what it helps is to help us to understand what kind of biases we can have either toward race or age or sexuality. And again, this is not a diagnosis. This is just an evaluation to see. Part of what some of the people were having the conversation and sharing with all of us, how we have to come to understand the outside world based on the culture and the experiences that we all have. So again, I would recommend to anyone who haven't done it, please do it. It takes exactly 9 minutes and 30 seconds. And then ask some question to yourself, right? What is your reaction? Do you have any resistance when you read the results? What experiences in your life have contributed probably to these results? And how might your perception of biases influence sometimes your colleagues' results and relationships? So one of the things, this was actually implemented by Dr. Banerjee in 1986, and this is what's actually 25 years later, they did a massive studies of almost 500,000 samples of responses to the implicit association test. And again, most of the biases were measured above 70% when it comes to gender, race, disability, and again, I would really recommend for you to take the test and see where are you in this type of biases that we can have. She actually have also a really good book called Blind Spot, and I have issue with the title. But again, part of what she said that I think it is very important is that implicit bias come from culture. I think of them as a blueprint of the culture of our minds. Human beings have the ability to learn, to associate two things together very quickly. That's the thing. What we teach ourselves, what we choose to associate it, is up to us. So I think that she's calling it this responsibility that sometimes when we interact with others and create implicit bias, create a culture of this us versus them. And I think that part of it, we're really trying to create an environment that is inclusive, that we can all engage in. We need to figure out ways to address it, right? And that's what we want to do today. And the first thing that we have to do in order to address implicit bias is recognize that if you have a brain, you are biased. And sometimes this can actually conflict, right, with our unconscious attitudes, behaviors, and intentions. So I want to do our last activity of the afternoon. And since we don't have, I can actually share this on the, oh, it's not allowing me to do it. I want you to think, right? And people who are present in the room, don't think about 5 people, think only about 3, okay? Take just a minute to think about 3 people in your life that you trust. And I'm not able to see the room, but I want you to think about 3 people and we want to do something. If you have 3 people in your life that you trust, you raise your hand and keep your hands raised until I say something that and then you will actually put it down if my statement that I say, it doesn't coincide with the 3 people that you have in mind, okay? So first question is, do you have 3 people that you trust? And raise your hand, yes or not. And the people who are virtually, you can also think about, you can write them down if you want. And my first question to you is, if you have your hands up, among those 3 people, is there a man in that group? If it's not, put your hands down and leave it down. You don't have any other option to put it up at this point. If there is a man, keep your hands up. Keep your hands up. Is among those 3 people, you have a woman within your 3. If not, put it down and leave it down. Now, keep your hands up. It's among those 3, you actually have a Latina woman among your 3. If not, put it down. A Latinx woman. So for those of you, and I know that you're getting tired with your hands up, but if out of those 3, do you have a person who is a Black woman? If not, put your hands down. And if you keep your hands up, if among those 3, you have a trans person as one of your 3 that you trust. If not, you put it down. and keep your hands up if you have among those three a Black man. If not, put it down. So I guess that, and thank you everyone for participating. We can continue. Part of what it is important here is for us to recognize that who do we have close to us is exactly the way that we interact and start seeing the world throughout, right? Because those are the people who are closer to us that help us to see who we are, but also how they see us. And the less diverse that group is, the more biases that you can have toward anybody who is different than you or that group. And I don't know, I wasn't able to see who kept the hands up, and thank you for doing it. But what is more important is to think about, when thinking about people, and this could be at work, this could be in your family, this could be with your friends, right? How different other people that you usually hang out with, work with, or spend time with from you, in base of age, in terms of race and ethnicity, in terms of level of education, in terms of gender, in terms of language, etc. So what I'm saying in a way is that sometimes, and particularly within organizations, the fact that the circle of trust, it gets, of course, reduced every time, that those are the people who can actually get promoted, get visibility projects, and in a way, the moment that this idea that it creating this sense of us versus them, it creates exactly that. And it's not that you don't want to, but it's that your brain, the way that it has associated anything that is different than you already actually put on the outside, at the out group. And that's what is called affinity bias, right? So again, part of what this work really is try to engage with the way that we engage with others so that we can continue learning and growing from our differences. So ways that you can mitigate your biases. Again, the first is to recognize and accept and increase your awareness about biases. What are they? I would really recommend to do the implicit association test. It will help. The other thing is to look for commonalities, right? What in psychology we call common identity formation. And apart from that, to engage with others. Differences could be difficult sometimes, but again, try to engage for that commonalities that you can have, that it can create the engagement and overcome those perceptions of those primary dimensions of identities that we can actually have a lot of association with. And then challenge your experience and knowledge, and what we call perspective taking. Try always the fact, one of the bias that is very common that we encounter is confirmation bias. And it is that we see the world with the information that we have, similar to the example of the cow that I showed you today, right? So again, part of what we're trying to do is challenge your experience or your knowledge. Ask somebody else who you think actually think different than you. Engage with others that are different than you. And sometimes we need to explore awkwardness and discomfort because these conversations can be a little difficult, right? And sometimes the elephant is in the room and nobody speaks about it. Somebody says something. One of the ways that implicit bias shows up a lot is around microaggressions. And we don't have time to talk about them, but sometimes people engage in them, but people don't say anything because of the implication that it can have. And then try to counter stereotypical exemplars. And this has to do with the activity that we just did, in which we need to engage with people that we consider others or different than us, and expose yourself to those positive role models in that group so that you consciously can actually engage differently when you pay attention to people who are somehow different, and start learning from them with humility, right? And then finally, Pay attention to your emotional intelligence, right? What are your self-awareness, self-regulation? What is your motivation for engaging with people? What is your empathy? And what are the social skills that we need to have to really engage with people? Just to tell you a story in how we can make this association and start changing the way that we think. In a meeting I have here, when we finished the meeting, I was walking with a black, very young looking black woman. And I'm trying to engage in conversation and, doing a small talk. And I asked her the question of, hey, what year student are you here at the Yale Medical School? And she turns back to me and she said, actually, I'm not a student, I'm a physician here. And of course, I was like, we say in Spanish, trágame tierra, almost like, let me get on the ground here. After many years of doing this work, I've still made this kind of associations because she looks young, she must be a student. So again, part of what I say, wow, I'm so sorry. I cannot imagine what it would be for you if, to experience this constantly with patients and also coworkers. And she say, amen, right? But again, part of how I can interact now in looking at perspective taking and engaging with people who counter stereotypical say that because she is a good young woman or seems young, she must be a student. Now I have a different learning, right? And my question now would be, what is your role within the Yale Medical School? Without imposing my own ideas, without imposing my own associations, so that I can engage more honestly if I want to learn about that person. Now, this is at the level of individually that we can all do and engage, but we can also do at the level of systemic. And we do know that equity in health will mean equal access to available care for equal need. It would also mean equal utilization for equal need, as well as equal quality of care for all. And there are many ways that Margaret Wood Health actually really say, right, is how we can create policies that are improving with the living and working conditions of people. We also need to have equity policy that should be directed towards enabling healthier lifestyles. An equity policy that requires a genuine commitment to decentralizing power and decision making and asking the people who's most affected by the issue to be engaged in the decision making process and engage in any level of that. And then we need to do health impact assessment together with intersectoral action. And equity in healthcare is based on the principle of making high quality healthcare accessible to all. Now, this work starts with each one of us, and it takes work. And even when it can create difficult conversations, we need to figure out a way to engage with them. And yes, it takes also time, because we're talking about changing cultural norms as well as changing systemic structures. And it is important for us to see how we can create those systemic changes that can create health equity for all. So remember, part of what we want is for all of us to be included so that we can feel connected, respected, that we are contributing and progressing in our own health and taking our health in our own hands so that we all be included. And I just want to leave you with this quote that made us to think about where do we need to put our attention to our solutions, is that when a flower doesn't bloom, you fix the environment in which it grows and not the flower. And thank you for Alexander Danger for sharing that. And thank you to you, for all of you, to be really here this afternoon, listening to this conversation. I know that we have only like 2 minutes left, and I'm willing to answer any question, any comment that people have in regards to this.
Does anybody got any questions from here in the ballroom? I know the day is getting long and we're all starting to run out of energy a little bit. But that was such an amazing presentation, such great information.